The American Cancer Society estimates that more than 87,000 new cases of melanoma were diagnosed in the U.S. last year alone, and approximately 9,700 people died from the disease. Of the many types of skin cancer, melanoma is the most serious and has also become increasingly common, with the incidence rates growing by nearly 50% over the last 15 years.
Most melanomas, not all, but most of them are caused by exposure to UV radiation, meaning the sun, or tanning salons, for example, which can damage the skin, and that sets up the process of cancer in the melanocytes, which makes a melanoma. And as you saw, it's increasing in likelihood, it's increasing in incidence, and the number of deaths, thank goodness, has probably plateaued, but the incidence has gone up every year over the last 20 years.
And there seems to be a common thread for those most susceptible to melanoma.
Anyone who lives in a sunny climate has had a lot of sun exposure. Red hair, blonde hair, blue eyes, green eyes, a lot of freckles, a lot of abnormal freckles, family history of melanoma. Those are the people at greatest risk.
Dr. Louise Perkins is with the Melanoma Research Alliance, the largest nonprofit researcher on melanoma, and says melanoma patients need to ask questions when visiting their doctor.
Well, you should definitely ask them, what are the latest in treatments? Are there immunotherapies that would be right for me? What are the potential side effects of these therapies? What's your experience in using these therapies? And what are the goals of my treatment? We'd also recommend for any cancer patient that they obtain a second opinion.
There is some good news for melanoma patients. A new treatment option has been approved for use in people with melanoma whose cancer and affected lymph nodes have been surgically removed. The new therapy stems from an innovative area of research called immuno-oncology.
Immuno-oncology is sort of the science and study and treatment of patients with drugs that stimulate the immune system to kill the tumor. Those drugs don't directly kill the tumor cells, but what they do is they stimulate the immune system, which in the cancer-bearing state doesn't function normally. We call it exhausted. It's dysfunctional, and you can reinvigorate the immune system with this new class of drugs that have been developed over the last 15, 16 years to use the immune system itself to get rid of the tumor and prevent the tumor from returning after surgical removal.
To learn more about melanoma, visit the Melanoma Research Alliance at melanomacure.org. And to find out more about the latest advancement in treatment, talk to your doctor and visit opdivo.com. Bringing you the best of California, I'm David Wiley for California Life.